Alright, I am doing a video on IV insertion. I am outside of my patient's room and I am looking at her MAR, looking over orders. My patient is Mary Smith, date of birth 5/18/1963. I'm looking over her allergies and I see that she is just allergic to morphine. And the doctor had put new orders in for IV fluids, so it looks like we'll need to place an IV. So that is what I'm about to do. I'm going to gather all my supplies outside the room. Once I have everything prepared, I'm going to head to the room. I'm going to knock on the door. Knock, knock. I'm going to hand sanitize my hands. Washing my hands. Pull the curtain closed for privacy. Good afternoon. My name is Jenny. I'll be your student nurse today. Can I have you please tell me your full name and date of birth? And she tells me Mary Smith, date of birth 5/18/1963. Armband matches up. I have the right patient. Mary, I am here today because your doctor had put some orders in for us to start you on some IV fluids, which will help take care of your dehydration and rehydrate you. And so that means that I need to insert an IV catheter into your arm. Have you had an IV in before? And she tells me that she has had one before. I asked her if she had any issues when she had that, and she said no, that she did not have any issues. I'd also want to ask her preferred arm, which is usually the non-dominant arm, which in her case it is, so she'll use her left arm. And so in that case, I also want to assess, make sure that she hasn't had a mastectomy done or any lymph nodes removed or any fistulas in place. If that were the case, we would not use that arm and use a different extremity. I see that she's in the lying position and that her extremity is dependent, which is the preferred position. All right, Mary, and I just want to make sure that she's able to follow commands in case I need an extra set of hands to help stabilize an arm and help her follow commands. But in this case, she's with it, she's alert and oriented, so that's great. All right, Mary, I'm just going to place this absorbent pad underneath your arm for any drainage. Very good. Okay. And I got all my supplies ready here. So first, I just want to kind of see what veins we're working with. So I'm just going to place this tourniquet around your arm. And I'll just apply this briefly. I just want to kind of see what your veins look like. I'm going to apply it snug, but not too tight. I'll check radial pulse. I don't want to occlude the arterial blood flow, and I feel a radial pulse, which is good. So a way to assess is just kind of visualize. I see I have a nice straight protruding vein right here. Some ways to bring that out is to lightly tap it, which will bring it to the surface. Another way to check is to apply heat to the extremity before inserting an IV, so a warm blanket, wrap it for about 15 minutes. But this, I found a good vein. It's nice and straight, so I know which one I want to use. So I have all that ready. I'm just going to prepare my needle and my saline lock. So first what I want to do, I'm just going to cleanse my saline lock, the port at the end here. Clean that. And I have a saline flush, 10 ml saline flush. I'll just make sure there's no air bubbles. Looks good. And I'm just going to attach that to my saline lock. And I just want to make sure to prime the tubing so there's no air that gets in. Looks good. Just going to set that right there next to you, Mary. Just check that was locked. Okay, I have my needle right here. I have my dressing ready. I'll set that right next to her. So I'm ready for that. Okay. And I'm just going to go ahead and put my gloves on here. Okay, so I'm going to apply the tourniquet. The important thing to know about tourniquets is don't leave them on for more than 2 minutes. Check the radial pulse. She's got a nice good pulse here, so it's not occluded. I'm just going to cleanse my site. Looks like right here in the antecubital. I'm going to cleanse in a circular fashion, moving outward for about 20 seconds. Toss that. Let that dry. Okay, yep, good pulse. Okay. All right, Mary, I'll have you take a nice deep breath. Okay, And as I'm preparing, I want to make sure that my IV needle is 15 to 30 degrees. So we'll put here. All right, Mary, you're going to feel a little poke. Okay, there's the flash. So then I'm going to drop the catheter parallel, advance it about 1/2 centimeter. I'm going to grab my catheter. I'm going to retract my needle. Remove the cap. Fasten that. Just going to flush it. Appears to be flushing quite nicely. How are you doing, Mary? She says she's doing fine. Very good. I'm just going to kind of tape it here, kind of secure it in place. And I'll apply the dressing, making sure not to touch the middle of my dressing. And remove that. I did make sure to label date and time beforehand, so I'm just going to apply that. This is important so we know when the IV was placed, and it was a 20 gauge needle. I'm going to finish flushing. And I'm flushing with 10 mils of normal saline. How are you doing, Mary? And she says she's doing good. Very good. Got it all flushed. I'm going to disconnect, and I'll put that in my trash pile. I'm just going to clamp this right here. And I'll tape that in place so it's not flopping around everywhere. It just kind of keeps it more secure. Okay, turn the cap off. Make sure that's not more than 2 minutes. I have all my trash. I put my needle in my sharps container over here. I'm going to take my gloves off. Clean up my supplies. We'll toss all that. Wash my hands once more. All right. So the IV is in place, Mary. I just want to let you know that it was a needle to insert it, but it's just a catheter that's in your arm. So it's nice and flexible. So the needle is out. It's just the flexible catheter in your arm now. And that's for IV fluids and giving you medications through your veins. And so before leaving the room, I want to make sure all safety concerns are addressed, that the bed's in a low position, that she's got her call light within reach, all her personal items. If she's a fall risk, make sure that she knows to call for help when she needs to get up out of bed. And it seems like she tolerated it well, so I'm going to wash my hands, I'm going to leave the room, and I'm going to chart and document what just occurred, and that the date, the time, the gauge, and type of needle that was inserted, how the patient tolerated it, and that was done in 1 attempt, so the number of attempts, and any solutions that were used, and in this case it was normal saline, and that concludes this. Oh, one more thing is lifespan considerations is for pediatric patients, sometimes it's helpful to have maybe the mother in the room to help comfort the child because it's a pretty stressful situation, and they might need to help hold the child as well. And then for maybe like the geriatric population, they've got pretty hard to access veins, so sometimes using warm blankets or butterfly needles can be helpful because butterfly needles are smaller, so they're not quite as big and not as painful to the patient. And that concludes my video on IV insertion.